Dr. Olumbe is my name, or Rosaline if you prefer. And I just want to confirm as I go through the list, Alan Raggi, the effects of mushrooming daycares on holistic child development in the informal settlements of Kajiado. Alan Raggi, okay, so you are present. And then engaging caregivers to enhance achievement of desirable learning outcomes. Maria Omare. Maria. Okay, we don't seem to have Maria. Sorry? Yeah, could you be online? Now we are there. You could check in the recordings. Okay, let him check. And then kuishi na kustawi. Mary Claire? Online. Okay, so you check those. No, those are not for this room. Breakaway room 2. They are not part of the presenters for room 2. So maybe just check again. So Mary Claire Nyore, I don't think we can see her here. And then we have challenges facing children. Lynette Kaloki. Sam Niwewe. Okay, so Sam is here. And then we have using IDELA approach in ECD. Patrick Ooko. Patrick Ooko. Sorry? Okay, so it's present. No, that's the online ones, eh? So we'll sort it out. And then parental employment on holistic, Stella. Okay, Stella is here. And then can take enabled distance learning, work in lower income settlements. Chepkoech, Faith. Faith Chepkoech, online.
She's online.
Okay, she's online. All right, so I think it's only one person we need to confirm, but we seem to have all our presenters for today. And what I need to confirm for those who are presenting, do we have your slides already? I haven't seen them. They were submitted. Yeah, because I'm seeing I don't have the slides, so what we need to check quickly is whether our laptops will work. The idea was to have everything centralized. It makes it easier. So we need to check that your laptops will be able to connect, and that will help us to move quickly. If you can just come and try, I'll give us just about 2 minutes. Stella, you can be coming to check to avoid saving, and welcome. Sorry, those online, do you have the presentation, Sally?
Yes, I do.
Okay, so Sally has the presentation. So if you had submitted, we are sorted. If you had sent your presentation, we are sorted. So it's only, but at least I can see yours is working. We're trying to. Oh, it's there. Okay, so you need to send it so that we have it there. Yeah, so I think if you can let us, we have it there, that will be easy because I can see it's not working. Okay, because of time, and we really want to start off this session, we'll not go around introducing ourselves so that we save time. For the presenters, it's already 4 or 5, and we have 7 or 6 confirmed presentations for now. So what I'll do, I'll give each one of us about 7 minutes, just 7 minutes. And then what I would like us to do, can we keep the questions for each session? When somebody presents, just take the questions and the comments so that we save time. And then the remaining minutes, we shall all now come together and raise questions to the different presenters. Is that good enough? Yeah. I'm struggling where to stand. Where do you think is the right place? Right here. Okay, so let's have presenter number 1 come over, and we'll time 7 minutes only we want to save time, and even for those online, we just have it ready to run. Alan, Ragi, if you can come. Can we project that, Alan Ragi? Yes. So maybe for the, as we look for, I think they need to look, just have them sorted out, please. Do we have it ready? I know you need this one, eh? So for those who may be with us online, we introduce our very first presenter. Okay, Stephen Ikonya, and he's presenting a paper on behalf of several others, but the paper is titled The Effects of Mushrooming Daycares on Holistic Child Development in the Informal Settlements, Kajiado County. So, Ikonya, we give you 7 minutes. You can take us through that.
Thank you so much. Good afternoon. My name is Stephen Ikonya. Presenting, I work with the Kenya AIDS NGOs Consortium, or KANCO, and I think I'm set to do the presentation. So as we set up, we are currently implementing a project in funded by Comic Relief in 3 counties. That is Kiambu, Nairobi, and Kajiado. So the project is called Malezi Bora ya Awali Project, whose aim is to promote access to early childhood development access services in the 3 focus counties. And we were able to carry out a study in 2 of the counties, that is Nairobi and Kajiado. But our main focus today is on what we found out in Kajiado County, and possibly some of the interventions that are working as a result of our engagements with both the national and the county government of Kajiado. So, thank you so much. So far we have been able to map out quite a good number of childcare facilities in Kajiado. We are already working with around 56 daycare facilities. And my presentation today is on the effects of these mushrooming daycares on holistic child development. The next slide, please.
Bring it here. Let her be here. Yes.
Thank you. So on the background, so the first 2 years of life offer a unique window of opportunity for a child's physical growth and development. And we all know that appropriate childcare practices then, they are very critical. This includes food preparation and feeding, psychosocial stimulation, the hygiene practices, the care during illnesses. They are critical during this period to prevent undernutrition and impaired development. So evidence from sub-Saharan African countries indicates that such activities are most often performed by the mothers as they are regarded as the primary caregivers. But due to the shifting family and work structures, so that means that paid, the largely informal childcare seems to be becoming the new normal in most of the urban settlements. And this represents now the millions of preschool children who are growing up in these childcare facilities. But we are not sure, or rather, the research on the quality of these childcare practices is quite small currently. And therefore, through the Marezi Boraya Wari project, we sought out to explore the childcare market in Kajiado East informal settlements by documenting, understanding, and linking the demand and the supply sides of these mushrooming daycares to guide subsequent development and implementation of ECD interventions in the said county. Next. So this is the problem that Kenya has a large young child population of around 12.2 million children who are below 9 years, and 17% of these children are in Kajiado County. And as at 2019 census, that is the number for Kajiado County for the other 5. But stunting still remains high in Kajiado at 25.3% due to high incidences of morbidity, low VAS coverage, or vitamin A supplementation coverage, poor water and sanitation, and hygiene practices, especially in the informal settlements of Kajiado East, with mushrooming child daycare facilities in the Kajiado East. Population growth in Kajiado East is also very high, and it is contributing to poor child nutrition and health practices, especially in the informal settlements, since mothers or caregivers have to leave their children in the informal child cares to work and provide for their family, mostly in the EPZ and also in the flower farms. So these are the objectives for our study. The aim was to assess and document the effects of the mushrooming child care centers on holistic child development in the informal settlements of Kajiado East, with the specific objectives to identify all the operational child care providers within the mapped areas, to understand the child care environment and access to care by exploring experiences of caregivers, to highlight the challenges faced by the child care providers in the informal settlements, and to build an understanding of the child care system stroke market, and to guide subsequent development of and implementation of ECD interventions. Next. Thank you. So the sites that we focused on, number 1 was in Isinya, where we have 2 slums, and then Kitengera ward, and then we have Shorinke and Orosikon wards. We used the quantitative and the qualitative methods. Next. So in terms of the findings, an assessment of 56 daycares in Kajiado County indicated that, number 1, 81% of these child care facilities were informal, unregistered, and the caregiver to children ratio was very low, and they did not have enough play materials or toys. Number 2, we realized that the shortage of trained caregivers was common in most of these child care centers, as 43.1% of these caregivers lacked skills and capacity on care, nutrition, child care management, and safety protocols were mostly maintained, though, in most of these facilities. The space in these centers varied, with 38.6% having inadequate space, 45.6% did not have adequate water provision, and soap for hand washing, that is in spite of the current COVID protocols. 79.9% did not have adequate disability-friendly structures, and 66.7% of these daycares did not have health records. And then over half of the daycare centers did not prepare food, and none of the children took expressed breast milk.
Our time is gone,
Okay, next then. For the findings. 1 minute. Next.
And the second is over.
No, the next, the other one, the last one. The last one. So I think this is what I wanted to highlight in 1 minute.
No, you don't have it.
Thank you so much.
Yeah, if we have time at the end,
Okay.
we'll add you. Thank you so much.
Thank you so much.
Okay, let's have the next person. And that is Maria Omare. Did you say happy enrollment, Maria Omare?
Let me see whether I can read together.
Okay, and we look for Maria. Who is she? Can we spell it? Maria? It's not there. All right, I thought it was there. Didn't allocate me some? We can do it. So again, just for us to introduce our next presenter. Challenges facing children in urban informal settlements. And effect on early
Challenges.
childhood development. The presentation is being done by
Sami Muremi.
Sami Muremi.
Okay. Yeah, imeandikwa Linet Kaloki. Yes. I hope this will not count to the 7 minutes as they arrange the thing. So okay. Okay, I'm Sami Muremi, representing Kidogo Innovations and also representing Linet Kaloki. Kidogo Innovations is an organization that works in the low-income communities in East Africa. And we are in Nairobi, Kajiado, Machakos, Kisumu, Nakuru, Mombasa. Yes. And we focus mostly on 0 to 3 years. And yes. Kaloki. Kaloki.
This is Linet.
Linet, yeah.
Kaluki.
Kidogo, all Kidogo. This one.
Which one?
Yeah, Kidogo. Okay. Okay. Yes.
Just connect that as we sort out the presentation. So please be opening the next presentation. So we can be opening the next presentation. Okay.
Okay, thank you. So, you can go to the next one. So Kidogo is a social enterprise that improves access to quality, affordable early childhood care and education in East Africa's low-income communities. So the problem and the study was focusing on the challenges facing children in urban informal settings and effect on early childhood development. And the category was childcare in urban informal settings. So the purpose of the study and the main questions. The purpose of the study was sought to establish the challenges that face children in urban informal settings and their effect on the achievement of full developmental potential, where the main questions of the study were: what is the situation in urban informal settlements in Kenya? We also looked at what the challenges do children face in urban informal settlements in Kenya. Then the next one was, what are the long-term impacts of these challenges on children's growth and development? And lastly, what are the intervention measures to help children realize their optimal development in life? So the finding and results were that in Kenya's informal settlements, that is conventionally called slums, where nearly 60% of the population resides, there are limited options for affordable and accessible childcare services. We also established that an estimated 30%, that is about 1 million children, in Nairobi alone live in informal settings, where in these settlements, children development faces various hardships, which limits their potential and realization of optimal development. And on the same, extreme poverty greatly undermines the ability of children to get and the caregivers stroke parents' ability to provide nurturing care and environments that are responsive, safe, and stimulating to the children. These are some of the aspects that are covered in the nurturing care framework, and their accessibility are important in ensuring that a child is developing to their full potential. Then another finding was that young children, that is 0 to 4 years, are mostly left in one of the 3,500 informal child care centers as their parents go out to seek employment, where they seek employment as casual laborers, housekeepers, or to sell different type of goods in the various urban centers. And these children who are left in these informal child care centers tend to miss out on a good start to life. And they also lack proper nutrition, health care, and access to quality early learning opportunities. Remember, that is occasioned by the extreme poverty that these children grow up in. Lack of these, so on continuation of the findings, lack of these important aspects in early life leads to effects that last a lifetime, including stunted growth, low level of skills necessary for working in life, limited future productivity, and a risk of a cycle of poverty. Then the neglect of children leads to failure in building human capital that is necessary for global development. And lastly, lack of access to clean water and proper sanitation, which is something rampant in these urban informal settlements, leads to or sees a lot of children suffer and die from sanitation-related diseases, and the children face communicable disease outbreaks, which doubles the numbers of the under 5 mortality rate and ultimately reduces their life expectancy, something that was captured in the UN Habitat report of 2015 to 2016. So there we see some of the play areas that these children grow and develop in, where they interact or come into close contact with poor sanitation issues, and as they play and interact with these ones, they are prone to diseases which hampers their development, and also they lack safe play spaces where they can play. Remember also extreme poverty, their parents have nowhere to leave them whenever they go to seek some form of employment. So that could be a play area for a child, since they lack safe play spaces, and as they play, they may get into such dirty water, and thus predisposes them to various illnesses. So the problem, which is the child care crisis. Okay. So in Kenya's urban informal settlements, where we have seen most of the children are live in, they lack accessibility to different early life and early childhood development and learning opportunities. So this is an example of some of the informal child care centers that the children are left in, where they lack proper stimulation, proper materials to play with, but that's what they have to contend with since the parents can't afford better. So recommendations for practice. What we recommend for practice and implementation is investing in quality, accessible, and affordable ECD health services to the children in urban informal settlements. Then providing nutrition supplementation to children who are severely malnourished, and also stimulation. Also, we recommend creating awareness on proper nutrition and responsive feeding for these children who are in these settlements. There is also provision of social protection and support for the caregivers to provide for the children in urban informal settlements, which can be in a form of cash transfer or economic support to help the caregivers to take care of their children better. Then there is targeting the caregivers in urban informal settings with information on responsive caregiving and its importance on child growth and development. It could be through forms such as educational tips or developmental related tips that could help them to bring up their children better, information on child protection and prevention of child abuse, information on how they could participate in developing their children better, brainy quotes, brainy tips on how they can help their children to learn and play, use of locally available resources to stimulate their children to play and such like. Okay. So our vision is to have proper early childhood care opportunities for children, even in these informal settings, with trying to help the parents to take care of their children and provide early opportunities better. So please be part of our story in changing those lives.
All right, thank you. You can appreciate him. All right, so let's keep our questions and our comments as he sits down. We want to go to the next presentation. I know we have somebody who's having a technical hitch. So we skip presentation 5 for now, and then we go to presentation number 6. Parental, I'm hoping it is open. Parental employment and holistic child rearing practices. Parental perceptions from an urban informal settlement. And the presenter is Stella Bugua.
So my presentation has a woman breastfeeding, but I have it here as well.
We need to be projected for the program. So do we have the presentation?
It has a lady breastfeeding. It's reddish. Okay, so as you're finding the presentation, I will just start introducing. This study was conducted by myself with mentorship from Dr. Olumbe and Dr. Waluli of Daycare University, and I work for the Ministry of Health. My name is Stella Mbugwa, but I also support Africa Early Childhood Network from time to time. 1 in 5 children under the age of 5 lack adult nurturing for at least an hour weekly. Many parents are unconscious that employment can, affect the quality of the caregiving and, of course, child outcomes. And for this, UNICEF and WHO 2020 found out that for children to develop holistically, they need nurturing care from trusted adults who are skilled to protect them. And yes, I shared. It's on the folder. It's on the folder, but I can open my computer if you like. Yeah.
For the sake of those who are...
All right. It's this one. It's there. It's in your folder.
Yeah, it's this one.
Yes.
I'm downloading it to project.
Oh, it hasn't downloaded. Okay.
We are really wasting time, right? We needed to have them ready, so by the time we are presenting, we just have them flowing. Otherwise, we don't save time. Okay, so is the next one ready? The last presentation?
You have to be ready for the presentation.
Okay. So,
No, she will present it from her side. So, but I need you to log in.
if we can be having the next presentation open, to save our time. Thank you.
So do I continue or start? I start. Okay, I will start. My name is Stella Mpugo. I work for the Ministry of Health. And this study was conducted by myself with mentorship support from Dr. Roslyn Olumbe and Dr. Ruth Walioli of Daycare University. I'm also an affiliate of Africa Early Childhood Network. I consult from time to time. So the study, as it's coming up, is the parental employment and holistic child rearing practices.
How was it
Wow. It is saved as parental perceptions.
Pole. Usijali. You have it on your knee. So you can give them to feed it.
Okay, so slide 2. 1 in 5 children under 5 lack adult nurturing for at least an hour weekly, and many parents are unconscious that employment can negatively affect quality nurturing and child outcomes. WHO and UNICEF found out in 2020 that for children to develop holistically, they require nurturing care from trusted adults for at least an hour. I mean, for quality enough, adequate. Next slide. So the study sought to find out perceptions of parents in Babadogo slum regarding the way employment or working can affect child rearing practices. I used descriptive design, and I conducted interviews to elicit parents' perception on child rearing. Employed parents of children below the age of 6 formed the target population of 600 and purposively sampled at 15% using the Fisher's formula. The sample was 83 families as respondents, and I was able to observe 83 caregiving environments, households. We used interview guides, observation checklists. So some findings, I tested the null hypothesis, and it was rejected, establishing a statistically significant association between parental employment and child rearing. And majority, that is 70% of the parents, 95%, were perceived their children as growing holistically, and then all the parents indicated that it was crucial to prioritize parenting, and then 72.3% reported that they were adequately nurturing. And this could be possibly because of the linkages provided with community health workers in the area. I inquired about the kind of child rearing support, next slide, that parents need, and they mentioned, they need holistic shared assistance from others, adding that they first needed to be psychologically well to be able to effectively nurture. As we know, Gesell 2019 found out that fathers who are involved in caregiving have better mental health, reduced risk-taking, and that those who had nonviolent connections with their children lived longer. Yeah? Some of the supports that are needed by these parents is free daycare services, access to free medical care, safe environments for leaving their children while they work, financial support, as reported by several parents. Next slide. Employed parents mentioned the need for economic empowerment and capacity building on child development, and I can cite one parent who said that they need guidance on how to nurture, how to discipline, what to consider when taking your child to hospital, and how to have a conversation with your child. Next slide is a picture of a child playing. Next slide. And that picture is courtesy of Little Rock. Then continued, most parents perceive their children as being very safe while they were worked, whether it was non-paid childcare at 51.8%, or whether non-paid, or whether it was paid at 48.2%. So some of the non-paid is grandparents neighbors, relatives. And then the parents particularly talked about access to fresh air, finding it as promoting child health. We know about vitamin D and sunlight. And then I did 57 parent-child dyads of interaction, and I found them very stimulating for young children. There was a lot of back and forth play activities, implying that the parents in the area, their caregiving interactions were very nurturing, and lots of fathers, because I conducted a study during the COVID lockdown in 2020. We found a lot of fathers supporting women to be able to work. Some conclusions is that employed parents were very intentional about their care during work days, but they had more time to nurture in the home on weekends. But nonetheless, these parents were pretty much with their children because of the COVID lockdown. The study recommended the following, which are significant, that parents working in marginalized settings need to prioritize early skills nurturing. Such best practices should be replicated, including, shared caregiving at the household level, and then that parents were actually negotiating for social and workplace supports. We found that they were getting paternity leave, they were getting paid time to go and take their children to hospital because of the relations with the community health facility there. And then the employers should scale up supportive best practices, especially the private sector. And lastly, civil society should design programs that are targeted at influencing parental behavior, but also that interventions on child development, especially 0 to 5, for children 0 to 5 should ride on existing structures for sustainability. That's the end. Thank you. I am done. Okay.
All right, we can appreciate So I want to go to the next presentation. I think I should look for the presenter online. I think we have representing on behalf of our Idela. So we can do the using Idela.
Is it the water center?
We need the Idela presentation, and then we need the last person is online, right? Which one is recorded? Sorry? Do you have a recorded one? No.
Is there one?
Presentation?
Yes.
No.
Okay. So we have somebody online to present.
You sent it.
Yes, I sent it. Let's check for my phone. Yes. So this one, it's zipped, because it has graphics.
So then I go? She's
Yes.
open.
Yeah, open it and then go ahead. You can be introducing yourself.
All right. Oh, you need to open this.
Okay, so no, his laptop is not.
It's not, the HDMI is not reading. Hi guys.
Hi. So maybe as he does, allow me to
Okay.
just introduce him. Represented 1.25 using IDERA approach for ECD learners assessment, and we have the presenters, and I think you're coming in on behalf, and that is
Yes, my name is, okay.
Sorry?
Yes. All right. Yes, they open it. My name is Benti Kochieng. I work at Save the Children. So I'm doing this presentation on behalf of myself, and my colleague Patrick is here. So then I'll just do the presentation. I'll try to be as quick as possible. And then all the difficult questions you can ask my colleague Patrick, who is our expert in ECD. So put it on presentation mode, please. All right, thank you. There we go. So we are basically presenting on a study that we conducted in Nairobi using what is called the Early Learning Assessment. International Development and Early Learning Assessment. So this is an assessment that is designed by our organization. Next slide, please. So basically this is an introduction of what IDELA is. I'm not going to go through all the points. but then it's some kind of a direct child assessment. It's intended for global use, and it's feasible in several countries. It has been tried and tested in 40 plus countries, mainly of the developing South. And basically, that's what it does. So it tracks progress on at a population or community level. Next slide, please. So this is where it has been tried and tested, and this is a moving target. The countries that are in red are the countries where the ideal assessment has been done. So you can see that in our country, Kenya, it has actually been done, and mostly we did it in Nairobi for what I'm going to present here, but we've also done it in Mandera and Turkana. Next one, please. So basically, what we assessed, we are targeting children aged about 3 to 7 years. And in this assessment, there are 22 core items. And these core items cover 4 domains. And then in addition, there are 2 executive functions. And the assessment with children usually take about half an hour. And it emphasizes continuous scoring, and it's play-based. Next, please. So what does it measure, and what did we assess? So we look at motor development, emergent numeracy, emergent literacy, and social emotional development. Next, please. So the purpose of our study was to establish the children's school readiness when schools reopened. Our objective was to conduct the assessment of children in the informal settlements in Nairobi. And we went to 3 ECD centers in Mathare, Kiforo, and Valley Bridge. So we sampled actually took the entire population of children in the 3 schools, because on average each school ECD center had an average of 34 to 35 pupils. So this, we did it across 2 rounds, first in January, the baseline, then we followed the same cohort, and in around July, then we interviewed the same children or did the assessment. So those are the survey tools that were digitized. We collected data from them, and we also got ethical approval to conduct that study with support from the Nairobi Metropolitan County. Next, please. So these are the constructs. I'll not go through each of them because of time, but basically these are the things that we were assessing using the IDELA tool. Next, please. So that is the distribution of the children. As I said before, they are drawn from those schools, and their ages range between 5 and 8 years. Next slide, please. Next, please. So these are the findings. I'll just highlight a few. I can't go through all of them. But at baseline, for example, 48% of the children who were assessed could not identify the number 12. But at endline during the second round of assessment, this dropped to 38%. So from this slide, you can just see that across all indicators, there was improvement, at endline compared to and consistently that happens a lot. Next, please. Then we also calculated some average scores for emergent numeracy domains, and we are comparing the baseline and endline. So I'd just like to draw your attention to the red findings. I'll not go through each of them, but you can compare boys and girls, and then endline and baseline. But then consistently there was also improvement at endline. Next, please. So these were the scores for social emotional development. Those were the average scores by sex as well. Next slide, please. Okay, this slide presents the average scores for emergent literacy and language domains, and those are the findings. So like towards the end, at endline, there was also improvement for both boys and girls. Next, please. Then this, I think, is the most important one. At baseline, their total average score was 66%. At endline, it was about 75%. So there was a marked improvement in that cohort as well. Next, please. So these are just, this slide shows, compares the baseline and end line. And basically this was what is called short-term memory. So someone would mention some numbers, and then the kids are, when they are being assessed, they're asked to repeat in that order. And this is how they scored at end line and baseline. Next, please. Okay, this now is the questions on healthy and unhealthy foods, basically nutritional status, and it also compares the baseline and end line. So that was also assessed, their knowledge of nutritious foods, junk food, and so on. And this is how they scored. Next, please. Then this basically attention. We tried to assess the attention span, and this compares the baseline and end line. So you can see that almost always the children were interested in the playful acts that, you know, and assessment that was being done with them. Next, please. Okay, so let's skip this, just browse through. Then we want to go to, maybe I can talk about the conclusions and stuff. So, okay, you'll give me 2 minutes, okay? One. Okay, thank you for your, generosity. So, I think okay, yeah. You read the rest? Yeah, okay. All right. Thank you.
Okay, so I know we only have about 10 minutes and we need to interact with this. And we have one presenter online. Can we find her? So as we get the online presenter, because I think we... Okay. Is she on? Okay. Sorry? Ask her. Okay.
Hi, Mildred. Can you hear me?
Can you hear me?
Yes, I can hear you. You can start your presentation. You have 7 minutes.
Thank you, everybody. Thank you, everybody. As well. Thank you, Dr. Olumbe, and all the organizers for having us here.
Maybe you can hold on. We have a technical hitch here. Are there two gadgets here? On Zoom. Is somebody on Zoom? There is somebody online and connected on Zoom. Okay, is it fine now?
The voice from right.
I think it's the microphone.
You have 2 microphones.
those who are sharing the best content, a bi-weekly radio show reaching about 200,000 listeners, and this has gone on since that time. A YouTube channel with which is full of free training content materials, songs, ideas, and a free phone dedicated call center providing 24-hour support. Let me hand over to Faith because of time, just to share the slide that reads our research question. Faith, please proceed.
Thank you, Mildred. So our research question was that, can tech-enabled distance learning tailored to low-income families be embraced by parents and have demonstrable impacts on child development? And our hypothesis seeks to find out if distance learning for preschoolers in lower income urban homes could positively impact child development. So moving on to our research methods, we had 4 objectives. We seek to identify evidence of use and impact of learning program at home and in open daycares. We also seek to inform and improve monthly learning content. We also are tracking child's progress and development, and we're also trying to seek to investigate the actively engaged parents in child development. Our study design involved 1,000 children in our active daycares, with a sample size of 108 for our first distance development assessment and a sample size of 110 for our second distance development assessment. These children were from the ages of 6 months to 4 years, and the method of selection was just simple random sampling. So just as Mildred has said, the learning support consisted of a monthly learning pack with parent and child-led activities spanning 4 developmental domains, video clips and text tips for child learning, a bi-weekly radio show providing parent and child-focused content, parents WhatsApp group, and a monthly phone interview with the parents. Onto our data collection method, it was via phone interviews with findings uploaded on a digital platform. For the scoring method for this particular assessment, we were awarding a score of 2 for any answer yes, that is, it shows that the child had achieved that particular milestone, 1 to emergent and 0 to not achieved. Our data analysis tools were SPSS statistical software, Power BI analytics software, and Microsoft Excel. So moving on to our key findings, we realized improvement across all the age groups and domains except the cognitive domain. And then there were biggest improvements found in social emotional domain across all age groups and in linguistic domain, especially the children aged above 2 years. Also, our results showed it was a reflection of greater parental engagement and use of learning materials and improved carer well-being. So the graphs that are there, we used Z-scores in our study. Z-scores basically is the standard deviations above the mean. So a positive Z-score is like that, the raw score of that particular child is above the mean, and a negative Z-score is the raw score is below the mean. So you can clearly see between distance development assessment 1 and distance development assessment 2, there was improvement across all domains except the cognitive domain. Let me quickly skip through some slides because of the interest of time and go to the key takeaways. So we found out that our program actually worked because it builds on social networks and carers' needs, and also it's because early child learning is determined as much as well-being as well as the content. It also worked because it was a blend of low and high tech, so it was definitely a low cost, and it was also partly child-led and partly adult-directed. So what we concluded from this distance development assessment 1 and 2 is that home-based distance learning can play an important role in child development, particularly when complemented by center-based in-person learning. Group interaction is also key for children, but also managers and mothers in our network. So I'll hand over to Mildred again for the summary findings.
Okay, Faith, in the interest of time, I'll just jump the summary findings. This slide is available on request. For purposes of today, we just highlighted our most recent study. Faith will walk us through that because the first study was done during COVID. We have got 1 minute, I can see, from Dr. warning us. So in that 1 minute, just allow us to just highlight for you our most recent study, the development assessment done September this year. Faith?
Thanks again, Mildred. So we did now what you call a developmental assessment. It was an in-person assessment, unlike the previous one that was distance. So this one was an in-person assessment, and one of the advantages it has is that there is that era of social desirability that was averted. So our study group this time involved 507 children, still the same age groups. And then the selection process was still the same, random selection. But what was different this time is that we did not use a 3-scale Likert scale, but we used a 5-scale Likert. So 1 was to show not yet achieved, 2 was emerging, 3 was able to do, 4 was achieved fully, and 5 was outstanding. So our findings showed that the older children were hitting their developmental milestones faster than the younger children. And this is attributed to the manager's confidence in handling the older children by providing them with more activities, as these older children tend to engage faster. However, we are still building up the manager's confidence in handling the younger children as they are receiving our continuous support. And eventually, we hope that the milestones will eventually improve. So our takeaways for this developmental assessment is that through our data, we have been able to improve our interventions and support managers by specifically addressing the gaps that have been found. There is also evidence that tech-enabled learning can be effective in supporting child at home and in the community. Also pointing to the opportunity to enhance the use of tech even in low-income areas to support early child learning. And finally, involving parents and caregivers in the learning journey of the children has been pivotal in improving child outcomes. The graph is still as, the Z-scores is still as before, like for the distance development assessment, but the results are different. You can clearly see that the older children were hitting their milestones faster than the younger children. So those were our observations for the recent developmental assessment.
Let's appreciate them. Is this on now? Okay. Okay, thank you. Okay, thank you for the presentation, Faith and your team. We are moving on. You had the benefit of doubt. I couldn't reach you. But we are done with the presentation. And I think it's already we can give ourselves about 10 minutes. Sorry. So we can go ahead and just bring our questions. And maybe the panelists, you could now just switch your seats for the camera, so they can face them. I want them to face this side. The presenters here. You can now just turn. And we can raise questions. I'm assuming that we've written down and now bring them around. So the first two questions. Or comments? Yeah. This is what we can see. Okay. So I have one. Any other person? So we'll start with this. Now that I'm nearer you. The only problem is that now the code.
I'm even louder, but I can speak without Okay. Now my question goes to I've forgotten your name. This gentleman who was presenting. Yes. Now, based on your findings, there's an area say that most of the children were not able to distinguish or to mention the healthy foods. Now, from your observation, did you maybe find out because there were children from the slums? Did you find out whether these children could access balanced diet before you ruled out that they were not able to mention healthy foods from unhealthy foods? Were they able to access even that healthy diet in the first place? Yeah.
Take note of the question.
Thank you. On presentation 1.21, the effects of mushrooming daycares. I would just like to know, did the study find out Kajiado County government have in place any regulatory or policy governing the registration and regulation of such daycares? And secondly, based on that, you talked about 43.1 of those facilities lacking capacity on care, implying that 56% have some capacity and skills. Could you very briefly share with us what capacity and skills those are, especially based on regulatory framework, if any exists?
Thank you. Any other question? Okay, that. Anyone else?
My question is also to Ben.
Bentic. You indicated that there's an improvement in the children and the involvement of the parents between the first assessment and the second. But she didn't tell us what interventions were done in between to bring about that improvement. Okay. Is there any other question? Okay. I need to get sanitizer.
Still on. We wanted to ask about the informal settlement in Kajiado. Have you mixed the daycares and the ECD centers? Or you're talking about the daycares which are in the informal sector, particularly in areas like Tengela, that should be a settlement area, and even Isinya. So I'm wondering which part of Kajiado East are you talking about? The informal settlement and the daycare, separating the daycares and the ECD centers, or you are putting them all together, camping them as one thing.
Okay, thank you.
All right, thanks guys. Thank you for your question. As I said, my colleague Patrick is there, and is actually our expert in ECD, so he can help us respond. First of all, I'd like to thank the two ladies for their questions, and basically with regard to the healthy nutritious foods. As I said, this is a play-based assessment, and basically we'd show the kids some picture cards. For example, some had meal, fruits and vegetables, some had chips, some had crisps and so on. And we'd show them photo cards, and they identify what the interpretation of it. Then you ask them amongst all those which are the foods that will make them grow big and strong, according to the language they understand. And so they'd pick them out. So they are like six picture cards with the groups. And actually only a few of them could identify all the healthy foods amongst the six. And those were not so healthy, like chips and stuff. Kids love sausages and stuff. But maybe they don't realize toothsome food, but they don't realize that it doesn't have as much nutritious value as, for example, fruits and vegetables. So that's how we were able to tell. And then the picture cards, because they live in Nairobi, so they have been exposed to all those kinds of foods, and they'd actually identify them. So that is the response. So with regard to whether they have a balanced diet, we don't know because we did not ask them that. So we couldn't tell from the questions whether they were having a balanced diet or not. They could identify that. And then my name has several variants. It's written differently. I'm called Bentic. So some people, the lady has also given some people call me bottleneck, Bitnik and so on. But basically it's Bentic. And yes, because Dr. here, she's a professor, so she doesn't give people a lot of time to talk endlessly. But having said that, I think we were cut short before we presented everything. But yes, to respond to your question, there are some interventions for parents, like for example, involving men more, caring and nurturing, showing the kids affection, positive parenting and so on. And then on the basis of that, the Ministry of Health together with us train some parents, some locally available materials to help them make play materials for the children. So some sacrificed to buy some comic books, exercise books, picture books and stuff like that, so that there would be a nurturing environment at home and at school as well. So I think that's my response. I don't know if Patrick or you'll allow. Okay, you're there. Would you like to add?
I want to say something about the intervention. Okay, as far as the interventions are concerned, very, very quickly, and I want to tell us that we did take the teachers through what we call the social and emotional learning training to equip them on how to support children
1, be self-aware. 2, to exercise self-regulation. 3, to embark on decision-making and forming positive relationships and so forth. So teachers were taken through that training. So they were supposed to go back to their schools and, of course, support the children that they are teaching on issues that were social and emotional related. When it comes to issues about emergent literacy, emergent numeracy, and stuff, we did take the teachers also through training, because we've had regular trainings for teachers on CBC. So we support them in appreciating the need for the use of play-based approach to teach young children, because of course that will help them to, at the end of the day, be able to comprehend a lot more easily. And together with that, we also involve teachers in the development of low-cost teaching learning materials, because of course we just can't teach children a lecture method. So we help them together with the parents to develop low-cost teaching learning materials, which they were also using in teaching children in the various domains. I think very quickly, I just want to say that.
Thank you. So we can have the Kajiado.
So thank you so much for the questions. And with regards to the regulatory framework for the daycare, and the reason as to why I used the name, or I coined the name, the childcare facilities, it is because we were looking at all the facilities for 0 to 5 years. And we realized that there are several of them, including the night cares in some areas. And in terms of the regulatory framework, we realized that there was none, and that is why currently, actually this week, the Kajiado team, through the Department of Health, started the process of working on the daycare childcare bill, so that they may see, we may see whether it may be possible for us to bring all the stakeholders together and see whether we can be able to come up with some regulatory framework for the same. For those, the 56% who had the capacity, it is because of some who have gained from the interventions of some of the partners, including Kidogo, who are also working in Kajiado, and some others. We realize that some caregivers have a diploma in ECD, though the turnover rate, that is what I was not able to mention, though the turnover rate is very, very high. Because of the sustenance of the same, and the fact that most of the daycare owners or the childcare, these daycare owners, they are not able to sustain some of their staffs, those that have more than one staff. The reason being, they are working, we are looking at the mothers of children who are working in the flower farms and in the EPZ companies in the Machakos. So in terms of the areas, that is, I think, the last question, why Kitengera, and considering that Kitengera is you cannot compare Kitengera with some of the slums that we have in Nairobi. We were not looking at the whole of Kitengera, but some of the slums that we have in Kitengera and Isinya. In Kitengera, we have the informal settlements we called Kiangombe. I hope you know Kiangombe. This is where most of the mothers who work in the EPZ companies, this is where they tend to leave most of their children. This is where we have most of these daycares. And then in Isinya, we have the Majengo slum. I think it is one of also growing slum in that particular area, with most of the mothers working in the flower farms in the rural end of Kajiado East. Yeah, hopefully I've been able to answer or respond to some of the questions. Thank you.
Are there questions online? Okay. Those online, if you have questions, you can. Maybe quickly, any other question? Because we need to end now and go to the next session. Okay. One brief.
Would be both a question and maybe an observation to Idella. The survey study was quite informative, but maybe my question is, do we have a comparative maybe set of findings that focuses on rural settings for maybe more analysis in terms of those outcomes that were being looked at. Thank you.
Make it brief.
Yeah. All right. Yeah. Thanks for your comment and question. I think it's quite relevant. So basically, in Kenya, we've actually not done a comparative study. But if you want to look at probably, areas that are probably rural, and a place like Mandera, I did mention that we've done it. So maybe we can compare findings from Mandera and Nairobi, and in the next presentation, if you'll allow us, then we can present those findings. However, I'd just like to quickly mention that in all the countries that it has been done, then this can also be, actually those studies can be there. Because based on this IDELA, there are even journal articles that have been published. So probably, across space and time and in all those countries, we can compare the findings. Thank you.
What Benfica said, we did do an IDELA assessment in Turkana. Yes, we did do an IDELA assessment in Turkana. So once once the report has been refined, then it will be possible for us to now do that comparison and see what we found in Turkana and what is happening in Nairobi. But we've done an assessment in Turkana on IDELA. Thank you.
Thank you very much, and if you allow me. Oh, okay. This is the very last one.
Yes, thank you very much to our presenters. I've heard 0 to 5, but I've not heard anything about children in the mother's womb. What do we do? Maybe all of you, that is the question which I have, because when you talk about 0, which age do we consider? Because like a child in the mother's womb still needs to be nurtured. What do you do in your organizations at that age? Pregnant mothers. Sorry.
1 minute for each one of you, and we close. Actually, not 1 minute, 30 seconds. Okay, we start from here. 30 seconds.
Thank you for that question. So on what we do for the 0, which is from conception, we usually target these mothers with information on ranging from the proper nutrition that they are to take, mental health awareness, and avoiding issues such as stress, because that information is very necessary. Seeking prenatal care during that period so that the baby is born without any complications. And also we also target them through what we call digital caregiving, where we help them with tips on how they can take care of their baby. The simple aspect like talking to the baby, rubbing the belly and singing, the involvement of the father at that stage, that's what we do.
Thank you. Okay.
Thank you so much. And I think one of the critical area that has been forgotten by most of the civil society organization is the fact that we need to influence the workplace policies to be both mother and child friendly. And I think this is one of the areas that we are seeking to influence by working with both the EPZ companies and the flower farms, so that they can understand how the rules when this mother probably ends up maybe giving birth to a child with CP, and compared to a mother who has given birth to a child who is healthy. I think working around influencing those policies would be critical, and also working with the county governments to ensure that they understand the importance of nurturing care framework, and how again we can be able to push for the same so that they can be able to work around the same at the county level. Thank you so much.
Okay, I think for stimulation is very important in utero, through reading, and I think whether you're Muslim, Christian, or from whatever faith you are from, the spiritual nurture, which is foundational. It's a foundational domain, so singing to the child, talking to the child, and involvement especially of the father. And I'd also like to say that in Babadogo, where the study was conducted, workplace support is really happening. Paternity leave, even if it's an informal settlement, organizations there are really supporting parents to, take their children to the clinic and all that. But in utero, there's paternity, maternity leave, and all that.
Okay, I'll try to be quick about this. Thank you very much, sister, for your question. But basically, we are proudly Save the Children, and we go to the ends of the world to try and reach every last child. So just to respond to your question, in our strategic plans that we've adhered to is that we want the children to survive, to learn, thrive, and realize their full potential. So basically survival, I think, maybe starts at conception, as you said, and we make sure that the children actually receive a healthy start in life so that they can later learn and thrive and realize their full potential. So we implement programs across all those areas. Thank you.
I'm sorry, I am a harasser, but I'm conscious of time, and if you allow me, we'll bring this to a close. Is that okay? And I think the essence of this presentation is to allow us opportunity to interact even after this. Even if I gave us 1 hour, we'll still have maybe things to say. So I believe now from this, form the networks, ask questions, give us your presentation, we'll read more and get to interact. But thank you very much for your cooperation. We really appreciate. God bless you. Enjoy your evening. Bye.